Hi, I'm Dr. Sandra Adams, and I'm a lung doctor. In this series of videos, I'd like to talk with you about some practical tips to help you or someone you love stop smoking. First of all, it's a proven fact that for many people, stopping smoking is one of the most difficult, if not the most difficult thing to do. But it is possible. We're going to talk about a series of tips to help if you're ready to get serious about trying to kick the habit and you really want to stop. Tip number 1, don't beat yourself up for failing to stop smoking if you tried to quit in the past or if you don't stop for good the first, second, third, or other time you try to quit. Studies show that it can take an average of 8 attempts to successfully quit smoking. So that means most people start smoking again several times before they're eventually able to quit for good. Now please don't take this information and think, oh well, I can't quit until I've tried at least 8 times. The number 8 is an average, so that means that some people can quit after 1 or 2 tries, but some people fail to quit up to 20 times or more before they're able to kick the habit for good. So in other words, don't give up. You are not alone, and keep trying until you do succeed. Myth number 1, stopping smoking is all about willpower and people who can't quit are just weak. That is a myth. The reality is a lot of people think that quitting smoking is completely about willpower, especially people who have never smoked. But this is not true. Willpower is important, but not the only thing that's needed for many smokers. We know that smoking cigarettes and other types of tobacco such as shisha and hookah show that the nicotine and other chemicals are very addictive, meaning that your body and your mind feel like you can't do without smoking. So willpower alone is not enough for many smokers to kick the habit. I'm not saying that willpower is not an important part of stopping smoking because smokers have to really want to stop to be successful. But smokers are not weak or bad just because they can't kick the habit. In fact, many healthcare professionals consider addiction to smoking to be a medical problem or disease. By calling the habit or addiction to smoking a disease, it helps people understand that quitting often requires, or at least is a little easier with help. I'm not saying that it's impossible just to quit on your own by throwing the cigarettes in the trash and never picking them up again, because I definitely know friends and patients who've been able to do this after some really life-changing event, like coughing up blood or getting really sick. But just quitting cold turkey without help may be very difficult or even impossible for many, if not most smokers. Also, by calling smoking addiction a disease, I've found that it helps patients and their families understand that smokers are absolutely not weak or bad people, just as patients with high blood pressure or heart disease are not bad or weak just because they have one or more of these diseases. Now, I don't have any magic or guarantee that if you follow my advice that you'll quit, because I know this may be the hardest thing you've ever tried to do. But I just want to share my experience and some tips that I've learned from friends, family, and patients over the years, because stopping smoking is the best thing you can do for your health.